Hello, everyone. My name is Jim Posner, and I'm the founder and host of the Don't Panic Project. Every week, we will be providing engaging conversations that educate, inspire, and empower people suffering from anxiety and depression. Today's guest is New York City pulmonologist Linda Rogers. Welcome to the Don't Panic Project, Dr. Rogers. How are you?
I'm great, Jim. Thanks for having me.
Oh, thanks for being here. Really happy you could join us today. So, Dr. Rogers, can you just start out by maybe just telling us a little bit about you and your practice?
Yeah. So I'm a pulmonologist, meaning I am a physician who specializes in health conditions related to lungs and breathing. I particularly focus on asthma, and in particular severe asthma, and I run a severe asthma program at a hospital in New York. And many of the patients who I deal with have severe chronic health conditions, and along with that can go a fair amount of anxiety and depression, which can complicate their illness.
Interesting. So a little bit of which came first, the chicken or the egg here. So quite often, would you say that the asthma leads people to having some depression and anxiety because of the condition, or would anxious people or depressed people tend to maybe be a little bit more prone to have asthma, or is there no concrete answer?
Well, it's an interesting question that you ask, and it probably goes a little bit both ways. So, for example, when people do research into the origins of asthma, particularly in young children, there's definitely been research that's looked at children living in environments of high stress, particularly in the inner city, and a higher likelihood of developing asthma. It's probably not the only factor, but it can definitely be a significant contributing factor. Moreover, the other aspect of it that you mentioned is probably true as well. People with asthma, like people with any kind of significant chronic health condition, that condition in and of itself can be a source of enormous stress, and it can form, more or less of a vicious circle where they may have some amount of asthma. Their illness, for whatever reason, understandably is a source of stress, but that stress and anxiety response may actually worsen their underlying disease, and they get into a bit of a spiral there. And so, apart from the standard medical treatments for these conditions, I think dealing with that component of it is a very important part of their chronic care.
So actually, what actually happens to people when they're having an asthma attack?
Yeah. Well, usually by the time they're having an attack, there have been things that have been going on for some time. Most people with asthma, more so in children than adults, have allergies, and the asthma is a manifestation of allergies in their lung. There are certain forms of asthma in adults that also inflammation in the airways of their lungs, but don't necessarily have specific allergies that we can identify. But for whichever reason, whether it's allergic or immunological but not allergic, these patients generally develop inflammation in their air passages, and that can cause narrowing of the air passages, making it difficult to breathe. And then sort of wrapped around your airways, there is actually muscle that regulates the opening and closing of the air passages. And people with asthma have a tendency for that muscle to be twitchy. And so if you imagine you have this sort of inflamed raw airway, and then you have a twitchy muscle, and certain things can trigger. So first of all, it can just happen. People can have it chronically because of the immunological process, and have symptoms on, some type of frequent basis, whether that's every few days or as often as daily or almost continually. But then you mentioned sometimes people have flares or attacks, and those can be brought on by things we breathe in. It can be triggered by, smoke, strong odors, respiratory infections, or things that we're allergic to, and being exposed to things that we're allergic to, the cat that you're allergic to, or seasonal allergies, particularly this time of year. So those are some different things that can trigger attacks. But people have also been known to develop attacks in situations of high stress. And so I've had patients who've developed attacks when they have strong emotions at for example, a funeral, or they have sudden shocking news, sometimes that can actually trigger an acute episode in and of itself. And that may be triggered through possibly through the vagus nerves or other mechanisms, neurological mechanisms. Mm-hmm.
So you mentioned the vagus nerve. Can you actually describe where the vagus nerve is and what functions it performs?
Sure. It's a major part of our health and well-being. It's a nerve that starts in your brain, in your what's called your brainstem, and it travels down through your brainstem, which is sort of like if you think of your brain on sort of like the root of it that goes into your spinal cord, that root is called the brainstem that leads down in your spinal cord. And then the vagus nerve comes out and runs down the side of your spinal cords and sends out branches to a lot of different systems. There are branches of the vagus nerve that regulate all your sensory systems, all of your organs, your lungs, your heart, and it controls things like it contributes to control of your blood pressure and your circulation. It contributes to circulation to your organs. It contributes to regulation of the airway muscle, like we talked about, and regulation of breathing, and really, your kidneys. Almost, if you think about almost any function, it really has branches into almost anything. It's particularly important with your heart and your blood pressure and your breathing, because things like deep, slow breathing trigger the vagus nerve to respond. And the vagus nerve triggers a relaxation response, relaxing muscle, slowing down your heart rate, lowering your blood pressure. And that's exactly the opposite system from your fight or flight response. That's what's called your sympathetic nervous system. And that's adrenaline based. And that comes through almost the opposite pathway than the vagus nerve. And so you're really countering that fight and flight response related to adrenaline with your vagus nerve and what's called your autonomic nervous system. So one's a relaxer and one's a get ready for a a challenging or a difficult situation.
Right. Very, very interesting. So are there ways that people can actually kind of cultivate the sympathetic nervous system and to slow down their breathing and actually calm themselves?
Yeah. Well, they're almost like, two faces of the same thing. When you trigger your autonomic nervous system or your vagus nerve, you're actually countering your sympathetic nervous system. So it actually, if the sympathetic nervous system raises your blood pressure and raises your heart rate and raises your blood pressure and raises your anxiety level, then the autonomic system does the exact opposite. And so when you cultivate your, things like deep, slow breathing and meditation, those all trigger the vagus nerve, and they slow down your breathing and slow down your heart rate and slow down and lower your blood pressure. And so by cultivating certain practices, you can really counter your fight or flight response, if that makes sense.
Yeah, definitely. As you know, I'm a meditation teacher. I do talk quite a bit about diaphragmatic breathing and, taking the time to actually really cultivate that skill of breathing into the diaphragm. And I've always seen research and heard people say how that, the slowing down your breath and trying to breathe into the diaphragm can actually help lower your blood pressure. So it's nice to hear you confirm.
Oh yeah, there's a definite biological basis for that.
Excellent. Wow. So getting back to the asthma, so what would be some of the treatments that can be used to help counteract asthma?
Mm-hmm. And so asthma is very variable. And so, there are some people who say that we shouldn't even have one term for the disease because it's really a syndrome with multiple different pathways. And there are large ranges of severity. There are people who have very, very mild asthma that say only manifests under certain circumstances if you're around the cat that you're allergic to or during certain seasons of the year. And many of those patients, if they're not particularly sick, may need a bronchodilator inhaler that they use on an as-needed basis when they have symptoms. The patients that I treat usually have more severe inflammation in their airways and need inhalers that reduce inflammation and may even need sort of bronchodilators that they take on a regular basis. But there are breathing techniques that can definitely complement their medication. And in fact, some studies show that part of the problem in asthma is that this shallow breathing that we talk about that happens under certain conditions. In someone with asthma who has a lot of inflammation, it may be that it's just there's so much resistance to breathing that it's too hard work, and so you tend just to take a shallow breath. And there are some evidence that that causes change in the muscle of the airways for it to tend to constrict, be more likely to constrict. So in a sense, that shallow breathing may trigger more reactivity of the airways that then may worsen the asthma. And so techniques with deep, slow breathing are being looked at as treatments for asthma and treatments of airway hyperreactivity. In some cases, we've used treatments like CPAP, which is a system that some people use when they have a condition called sleep apnea, where their breathing stops at night. Our research group found that when you use a CPAP mask, it may relax the smooth muscle of your airway by stretching it and giving it, making it more relaxed. And so you may be able to do that with deep breathing techniques as well, reducing the likelihood of that your airway may constrict.
So, wow, simple. I guess it's not so simple, but something that sounds as simple as kind of learning how to deep breathe can help counteract asthma and stress and anxiety, lower your blood pressure. Some pretty profound benefits.
Yeah.
Amazing. So, Dr. Rogers, you're also, not only are you a pulmonologist, but you're a pretty serious yoga practitioner. So can I ask you, as a pulmonologist, are there any interesting breathing exercises that you could share with us from your yoga practice also that you feel have helped you?
Well, yeah, I mean, a lot of the types of breathing we do during practice is, first of all, coordinating our breath with our motions. And usually when we're practicing, we coordinate, our in-breath and our out-breath with our movements. And I don't know if I can do it justice in terms of describing technically why that feels so good, but if you try it, it actually feels really good. In general, you're slowing down your breath and taking deeper breaths, and that creates that relaxation response during your practice, which just it contributes to the great feeling you have if anyone practices on a regular basis. You just feel great after you practice. You feel sort of relaxed and limber and calm and focused. Some of the breathing exercises that some of my teachers do are, I think it's called, I'm not an expert in this, but I think it's Kalabati breathing, where you breathe really, literally, you breathe through one nostril and close off the other nostril. You hold the breath in the back of your throat, and then you close off the other nostril and breathe the air out through the other breath. Then you take another breath in, close it off, open up the other side, breathe out. And you'll see, you're breathing through your nose, which if your nose is my nose, and particularly if you have allergies or anything, there can be a little bit of resistance there. But it does force you to take some slow, deep breaths. It also helps clear out your nasal passages, which feels pretty good. And so that's one of the things that we commonly use in some of our classes.
Interesting. I mean, again, as a meditation practitioner and teacher, you're actually forcing yourself to be present with your breath when you do these exercises.
You're really focused and concentrating on it. Exactly.
You're really tending to your breath and concentrating on breathing properly. When you do those exercises, should you be trying to breathe into the diaphragm, or are you just?
I think generally that's encouraged, although I can't say that I always get instructions to that specifically with some of the teachers that I do, but I do think that in general in yoga practice, diaphragmatic breathing is usually encouraged.
Interesting. So can we actually relate this back to the Dr. Rogers and maybe ask, is there anything physiological that's going on when you're actually trying to tend to this type of breathing?
Yeah, and I have to think that one through a little bit, separate from doing it diaphragmatically or doing deep, slow breathing. I'm not sure. I'm try to think of a physiological benefit of sort of doing it through your nasal passages, and it's not obvious to me what that is. I'd have to get back to you for that one.
Okay. All right. Well, terrific. So are there any other tips that you could maybe provide for us, again, as a pulmonologist, for using the breath to help heal or just calm the body down, or in certain
Yeah.
ways?
Well, I think we need to take what is something that we sort of rely on and it is very unconscious and really make it conscious. Uh, we all breathe and we breathe automatically and we don't really think about it most of the time, and the system is designed that way, and it's designed that way for survival. In your brainstem, which is sort of one of the oldest parts of your brain, you have a pacemaker that gives you a certain minimum set of triggered breaths that you will do so that you don't have to think about it, because there are actually certain very rare conditions where people lack that pacemaker in their brain, and they literally, if they don't consciously think and do every breath, they don't breathe, and those people actually have to be on respirators at night, because when they fall asleep and they're not conscious, they won't breathe. It's actually called Ondine's curse.
Wow.
Most of us, that's not the case. Most of us, it's automatic and we don't think about it. But in the process, I think of it being automatic, we don't do it very well. We do it enough to survive. We don't suffocate. Our oxygen doesn't go down. We get oxygen to our brains and oxygen to our organs. And, those are all good things, and those are enough. Um, but I think we tend to, particularly as many of us get older and our chest walls get stiffer, we maybe don't breathe particularly deeply. As we get older and maybe we gain some weight around our bellies and we're not in very good physical condition, we tend not to breathe through our diaphragms. And we do this, sort of shallow kind of breathing that will give us the oxygen. We're not going to end up in the hospital or in an emergency room, but it's not necessarily optimal for our health. And I find myself regularly during the day when I have something stressful that's happening to me, and that happens really on a daily basis. There's a lot of stress in my work, that if I can remember to sort of stop and take a bunch of slow, deep breaths, I can calm my stress response, and I can approach any situation with sort of calm and focus. And the more of my time I can spend in calm and focus, the more effective I can be in my personal life and be with my patients. And so I think it goes back to that, the concept of mindfulness meditation, that we should be part of doing mindfulness meditation is just focusing on the breath and just focusing on the breathing, and doing deep, slow diaphragmatic breathing. And I find it very helpful personally for me. I try to encourage my patients to engage with those activities as well.
So when you actually tell your patients to try to engage with deep, slow breathing, diaphragmatic breathing, are there any instructions that you give them to do that?
I try to actually encourage them to do something more formal, because there are things online that people can look at, and we talk about it a little bit in a practice, but I really think it's more effective to develop, if you're going to develop something like a meditation practice, to at least start with a teacher like yourself. I do recommend certain yoga classes and certain teachers to some of my patients if their health permits it. Some of my patients are quite ill, and probably a standard yoga class is not necessarily a good fit for them. But for many of my patients, I do encourage them to do it really more through that route than through any specific set of exercises that I do. But as I'm thinking about it, and as I'm talking about it with you, that may be something I may need to incorporate into my practice.
Yeah. To actually just backtrack again, though, to your point, how your day is stressful, and you've kind of you have a bit of a meditation practice, as you've said, and you have cultivated this ability to take a pause and just concentrate on your breath for a few moments, and how that relaxes you, and then you're capable of kind of regaining your concentration and just kind of carrying on. Yeah, I mean, that in and of itself is a really powerful skill, just to be able to know to check in with yourself at points during the day when stress, when you are in a stressful situation. I mean,
and it has to come to me, as you know, it's not always there. Part of the process of fight or flight is you're in a situation, and this is sort of evolutionary. This is, our bodies have evolved for that fight or flight to respond automatically. And so, some of us, it is more robust than others. And so sometimes a situation that triggers that for one person will not trigger it for another person. And so, sometimes things that are, we develop such a kind of overreactive fight or flight response that things that are really not an actual danger to ourselves trigger these responses, and sort of recognizing it when you feel it in yourself and sort of developing the skill to actually regulate it really, I think, takes quite a bit of practice. I would not sort of come to this and say that I'm perfect either. Today, I try to start my day actually with 5 minutes of just meditation and breathing, because I find when I do that I can go into my work very calm. And then as things start to come at me, I can handle it a little bit better. Sometimes I have a day like today where I walk in the door and just sort of stuff is happening, and sometimes I have to stop and remember, and I don't always remember right away. So it's a skill that we all work on, and the more we practice it, the more it comes easier, it comes more automatically, it comes sooner in a difficult situation. The more you develop the skill, it's like a muscle. And when you develop that muscle, you can use it more when the situation requires it, or you develop the routine of doing it. And so it's there for you at hand when you're in that situation.
Really well said, Linda. As a meditation instructor, I couldn't have said it better. That's what the practice is all about, because the difficult part is being able to go to it when you need it, when you're in a really stressful situation throughout the day, when you are being triggered. And, as somebody, I came into this whole meditation thing because I went through a 2-year period of extreme stress. I had a personal crisis, and I actually started to have panic attacks, and I went to the hospital twice thinking I was actually having a heart attack. And since I've learned how to meditate, I've never had another panic attack, and I have taught myself certain skills when I do feel particularly anxious, during particularly anxious moments. And quite frankly, the cornerstone of it is going to that deep, slow breathing, that diaphragmatic breathing that's just very relaxing. That, as you said so eloquently, there's real physiological things happening when you go to that actually calm you down and help you recover from an anxious moment. So that's what the practice is all about, is training yourself for those moments in life.
And it's really a practice, and it's challenging, it's just like exercising regularly or eating well regularly. Developing a meditation practice is a lifestyle change, and all of those types of lifestyle changes this is hard stuff. This is not stuff that comes automatically. It's stuff that we're all imperfect at, meaning we don't always do it as well as we might like to do it. But I think the key is sort of just getting back on the wagon and trying to do it. I've been really striving to have a 5-minute meditation practice every day when I walk into work. And like days like today, I wasn't able to do it because there was an emergency at work, but tomorrow I'm going to try again and not berate myself because I didn't do it today. And then the more, it's like anything else. It's like any kind of exercise or dance or playing the piano. It's muscle memory. If you really work out those muscles and develop those muscles, then it comes more automatically and comes more easily. And then when you feel the benefits of it, I think you're also inclined to do it. Like I know how I feel after I do it and how my day goes when I start my day that way. And that's always a better day than when I don't start my day that way. And sort of, there's if you can get past a certain point, I think that there's an intrinsic motivation to continuing it.
Definitely. And, like you said, you know how you feel when you do it. And
Yeah.
you know how you feel when you don't do it also.
And you know how you feel when you don't do it.
That's
Exactly.
the other side. But it is powerful. So, I want to thank you as coming from a pulmonologist for confirming the importance of the deep, slow diaphragmatic breathing and the benefits that it can provide. And I really, really want to thank you for being here today. Really appreciate your time.
It's great to be here, and I hope this is helpful to your community out there.
Thank you. I'm sure it will be, definitely. Thanks again.
Okay.